The latest report catching local healthcare system Bon Secours in the middle of a nationwide controversy tonight.
And this is happening once again. The U.S. Senate Committee on Health, Education, Labor, and Pensions now finding the nonprofit was one of many across the country benefiting from the 340B program between savings and revenue, raking in $276 million without putting that money directly into the low-income areas that it was supposed to.
8 News reporter Sierra Krug joining us live in Richmond. And Sierra, what have you learned?
Well, Eric, I think the big picture here is lawmakers are calling for reform because even though Bon Secours didn't technically break any rules or laws per se, the program was essentially stripped of its integrity and efficacy in the way it was applied. Lawmakers say the money saved really needs to be going back to those most vulnerable patients.
I've taught math for 29 years. Numbers don't lie.
And that number? $276 million. That's in both revenue and savings Bon Secours health system locked in through the government's 340B program, which allows hospitals in low-income communities to save money on medicines. In this case, Richmond Community Hospital, making the health system eligible.
Those communities are underserved with regards to doctors, underserved with regards to health care. They're often low income, which means they don't have access to the quality care that you oftentimes see in the other communities that always get the investments.
The U.S. Committee on Health, Education, Labor, and Pensions releasing a report finding Bon Secours, among other systems across the country, did not pass its financial benefits from the program directly to patients in their most vulnerable communities. The health system, as recently as last year, investing in big-ticket projects in more affluent areas like Hanover and West Henrico.
When you hear about an organization benefiting to the tune of $200+ million, you expect to see a significant investment in those marginalized communities, especially when it was the marginalized communities that were the spirit of the rules and the laws that provided those drug discount programs.
It is important to clarify the program does not explicitly say all money saved needs to go to any specific place. So lawmakers like Tim Kaine and community advocates like Pastor Ralph Hodge calling for reform to maintain the integrity of the program.
It should be really clear. If you received $1 million discount, we should see $1 million invested back into those marginalized communities. It's really, numbers don't lie.
According to the report, Bon Secours did not account for what specific expenses 340B revenue went toward, but the health system cited more than $16 million invested in a medical office building in Richmond's East End, plus capital investments totaling more than $3 million in the area too. Hodge believes the proof is in the people.
Are we seeing lower infant mortality rates in Churchill? Are we seeing less chronic disease? Are we seeing lower blood pressure, less diabetes? Your investment should have an outcome that's measurable.
Again, Senator Tim Kaine tells me he and other lawmakers look forward to reform. For now, live in Richmond, Sierra Krug, 8 News.